for Veterans Healthcare and Wounds of War. And she is accompanied by Brett Copeland, VHPI Executive Director of a nonprofit Veterans Healthcare Policy Institute, an organization founded by veterans, healthcare providers, and journalists. Brett worked on Capitol Hill as a communications director for a labor union that represented VA employees. Today we'll be talking about updates on COVID-19. That is the disease, COVID-19 is coronavirus disease found in 2019 caused by the SARS-CoV-2 virus, and also on veterans health care in general. So welcome, Suzanne and Brett. And I'm not sure who wants to kick it off. Would you like to speak?
Sure. Thank you. Thank you for having us back on.
Sure.
And just based on your comment at the top here, John Lewis, I think it's easy to feel a little lost when you lose a legend like him. But he lived his entire life showing us how you act in moments like these. So it's a hard loss to face today, but we have such an incredible example with him. And I think that coming now, a report came out last week that 10 million Americans have lost their employer-provided health insurance. And 48 million Americans live in a household where they have been impacted by a job loss. So there's a lot of people out there, including more than 1 million veterans, who have lost health insurance or lost their job. And that is really, from where we're looking, trickling down and not only impacting them and their ability to provide for their families and to get good health care, but hospital systems are also losing that revenue and beginning to close down. So, Suzanne, I know you did a lot of work looking at where veterans went during the 2008 recession, and a lot of them ended up in the VA, but how do you think will these losses in revenue and employer insurance really affect veterans?
I think that the fact that we now have 12% unemployment rate among veterans, so if in this country, if you lose your job, you lose your health insurance. That is to say, if you had health insurance offered by your job or you could afford the premiums. So in times of hardship and recession and unemployment, loss of health care insurance means that veterans will be seeking health care from the Veterans Health Administration, and even if they don't have a service-connected disability, if they've lost significant amount of income, they may be eligible. So we need we really need to beef up VA staffing and funding to accommodate these veterans, and there's the funding for the VA is often based on the last year's utilization. And so we're going to need special appropriations because if, you're increasing by 12% we don't really know how much percent, you're going to have to, you can't base your appropriation based on last year because the need is going to be bigger. And so, and also, if any of these veterans have had COVID-19, they may face even more health challenges because we don't know that much about this novel virus. We do know, however, that if you've been hospitalized and you live through it, it does have continuing health challenges added to the health challenges that veterans already have.
Yeah, and this is really really an important point because the actual virus itself, we know that it does cause pulmonary involvement with the lungs, and that's why people really need ventilatory support, being placed on ventilators. But we're also finding that it does attack blood vessels in the heart, the lungs, the kidneys as well. And so
it's a very bad disease, and I really want to make a pitch here, and this is kind of perhaps off point, but veterans have enormous credibility in their communities and in their nation, and I would like to see VSOs coming out with statements that people should be wearing masks, and I think veterans should be taking the lead in that. I mean, veterans have sacrificed, have shown and proven that they have sacrificed for their fellow citizens, and they've made really big sacrifices. This is a tiny little sacrifice to wear a mask when you go out on a walk, to wear a mask when you go into a grocery store, to protect the people that are risking their lives to take care of you. And I really would like to see more action. I mean, we just had an article come out in the Journal of the American Medical Association, proving that masks are effective. And there's too many people in America, who look at masks as a sort of political statement as opposed to a public health gesture and a public health emergency measure. And that's certainly not what we came on to talk about, but yes. I would love to see veterans leading the way in this like they've led the way in so many other things. And I think it's kind of tragic that VSOs have not really jumped on the bandwagon and talked about this. I mean, I'd like to see American flag masks. I'd like to see American Legion masks and VFW masks and so forth.
And veterans really are leading the way in combating this virus. In Phoenix, at the VA facility there, and the way that veterans have interacted with their dedicated healthcare system really helped stem the number of COVID cases there. As of July, not a single Phoenix Community Living Center resident or staff member tested positive for the coronavirus. That's incredible. Not only can veterans lead the way in emulating behavior that we all need to follow, but the way that their healthcare system works and the way they approach healthcare is really saving lives and can really help the communities where these VA facilities are in.
Yeah, I couldn't agree more, because the veterans, we took an oath to defend the nation, as we went overseas into combat zones and those kinds of things. And when we came back, we still have a civic responsibility to our citizens. And, I remember the first thing I thought about was going into one of the training sessions. I was in the military for 26 years, but going into the gas chamber, where we had, we were using some different substances that were like tear gas, and you had to put your mask on and before you went in. And then what they had you do is to take it off to see what it's like without the mask on. And we need to have that kind of reality picture come up. Without the mask on, you can actually kill senior citizens, your parents. You can actually go in and give people who have cancer, who are immunocompromised. You actually hold the chance in your hands of actually saving someone's life. So I think absolutely we should be pressing to wear these masks and to make sure we protect each other. We are part of the same community, and many of our seniors are faith-based leaders, business owners, our instructors and teachers, our veterans who are out there, our frontline workers, nurses, doctors, and we also have people who are in industry, and the person who's checking out your groceries at a counter. Who are seniors who are working, for extra money. So we really have to start thinking about what we're doing and not be so selfish, and to really consider someone else's life as being valuable.
Yeah, that was just so well said. I mean, I wish this could go viral, and it's almost like you need a Got Your Six mask, because you're right. I mean, it's helping other people, and many of the people that it's helping in these low-wage jobs who are, they can't work from home and so forth, are their fellow and sister veterans. Yes,
that's absolutely true. So, tell us a little bit more about this COVID and veterans healthcare from the perspective of VHPI, because I know you are involved with so many different aspects. Before COVID-19, you were in existence, and I said your work spanned so many decades. And how do you view what our responsibility is now in taking care of our veterans, and what can we offer them? How can we participate in that process?
Well, as you know more than anyone, when a veteran or someone serves in the military, essentially the whole family behind that veteran or the active duty person is really serving as well. And that's why VHPI has called before, and we're renewing that call, that we think the Veterans Health Administration should be opened up to not only veterans who have lost their employer-provided insurance, but also to, if they absolutely need it, to cover their families, because that sacrifice is carried not only by that veteran, but their entire family. And now more than ever, like talking about masks, the people who are closest to the veterans aren't just going to impact their, social wellness, their mental wellness, but really in containing COVID-19 and making sure that entire group stays safe, it's going to take the whole family. So having a way that veterans and their families can get care is what we're really looking at now.
Okay. Yeah, and we really favor, and we think that if there is a new administration, that we need to really push people into this, that, we really should be covering all veterans. We should get rid of these eligibility requirements that are crazy and costing people their lives sometimes, and we should open it up to all veterans, and also to their families, as Brett said. I mean, if your health insurance comes from the working partner in a family and you lose that health insurance, you're going to lose your family coverage, and that's crazy. And we really favor that, as well as opening up the VA, particularly underutilized VAs, to civilian sector patients who may have trouble getting health care. Ironically, one of the richest communities in the country, if not the richest, Palo Alto and Menlo Park in California, they have two major flagship Veteran Health Administration facilities, and they're very underutilized because how many veterans can afford to pay $2.5 million, which is the average cost of a house in Silicon Valley. These are underutilized, extraordinary facilities that, could take family members of veterans and also civilian sector patients, and we should be thinking about this. I mean, this coronavirus, is really opening up all kinds of, it's not only showing the real failures in the American healthcare system, as Brett pointed out, but it's also giving us opportunity to think more boldly than we often do.
Well, and this crisis is not even close to being over. Already this year, we've seen 29 hospitals file for bankruptcy across the country. In 2019, 22 had filed for bankruptcy. That's over $202 billion in losses. Some of these hospitals and smaller providers are just not going to make it. And we need to make sure that our veterans have a place that they can go. And under its fourth mission as America's emergency healthcare system, the VA is going to have to be there to pick up the slack from these for-profit healthcare providers.
Oh, boy.
And also these for-profit, and even if they're not for-profit, they're really for-profit, they're also furloughing staff. And in the biggest crisis we have in our lifetimes, everybody is listening, hospitals like Stanford University and University of, all these different places that have received loans from the government and have huge endowments, they're furloughing staff, they're cutting pay. The VA hasn't furloughed a single nurse or doctor. They've shifted them around. They've sent them to places where there are needs so they can serve civilian sector patients. That's the model that veterans develop in the military, where they serve their country. And this is the model that healthcare should follow, which is the model of the VA. We can't, as Brett said, this is not over. We have no idea what this virus is going to do. It is not going to go away by the fall, and we need to, to consider that we are in a long-term national emergency, and we need to use the VA for its fourth mission. The other thing I would like to say is that one of the things that we really need for the VA to come with after this is all over is, in 1991, before 1991, the VA had its own depot where it had its own supply warehouses. And then this crazy idea of just-in-time supply took over, and they shut that down. And so now the VA is dependent on the sort of private sector supply system, which we have seen
Yes.
fail everybody in America, and the VA needs to get back its own warehousing facilities so it can have PPE, personal protective equipment, and all kinds of other equipment and medicine and so forth stockpiled so they can not only help veterans but the rest of the community.
Oh, that's fantastic. And as you were talking, I was thinking about how our veterans really need to have the access to care, especially during this time. And many of the services and many of the hospitals have been sort of closed down enough. And a lot of states have phase 1 to 5 or phase 1, 2, and 3, where we were pretty much on lockdown. And now they're starting to open up a bit. But then we're seeing a resurgence of COVID in many states, mostly in our southern states currently. And one of the things that I've been pushing for since March is really to move the seasonal influenza vaccination from October, November to August, because what we don't want to do is have people going in to get their seasonal flu shot in the middle of a second wave. And,
Yeah.
and if we have that wave, and we have children, the Vaccines for Children program, 80% decrease in vaccinations, according to the CDC and some of the data coming out of insurance. So we really have some other threats out there, and making sure our veterans are protected, their families are protected, is really critical right now. And we have to do everything we can to avert adding on to our problem with a second pandemic wave.
I think that's a very good point, and I think that's a good point that should be raised.
Yeah, and one thing you were mentioning too, because another thought that came to mind is that we have military service members who are serving all around the world, and we have service members, of course, here in the States. But we also have contractors and civilians. Some of them actually were retired veterans who went back for a second job. So our contractors and civilian employees also are at risk as well. They're part of supporting our infrastructure for the military and our veterans. So any thoughts on them and how that fits into the picture?
Well, the web is so big, and the problems with America's healthcare system is, seemingly insurmountable. And you get a crisis like this, and a lot of those cracks, become very apparent. I think that in the coming years, we are really going to have to think about the way that we deliver healthcare in this country, and that it is not something that is optional for America's citizens. And I believe, and Suzanne has documented, the VA is the closest thing that we have to a universal healthcare system in this country. And if we are going to rebound from this, from the economic cost of this and the health costs of this, we are going to have to really rethink the way that we deliver healthcare here. And we're lucky enough to have the VA now. Hopefully, it continues to be strengthened. This last couple weeks, they've proven that they can hire a tremendous amount of people to work there. And that's what we need. We need more medical providers here in the United States.